exert themselves and try to return to sports or to play, the symptoms resurface. And that's why, to answer your previous question about why a Royal Commission is required, is we don't know the answers to a lot of these questions. We don't have effective treatments. A lot of concussions are going unrecognized. Children are being injured every day across the country. What we need to do is set up a Royal Commission so we can at least work towards answering these questions, and whatever information is available to us, we can share with people at every level of the country, at the grassroots level, and make appropriate decisions so that A, if somebody sustains a concussion, we know how to manage them effectively to the best of our knowledge today, and B, we can work towards primary prevention and preventing concussions through a variety of mechanisms.
Just to follow up very briefly, your question in relation to money earlier, there was the Smart Risk 2009 economic burden. Susan, you have it in front of you. Feel free to.
Smart Risk, who Dr. Jaws associated with, issued a report in 2009 called the Economic Burden of Injuries Report. And what they found was there are rather generic categories for evaluating or cataloging the types of injuries. But they basically, two categories were being either struck by sports equipment or striking sports equipment, so being hit with a stick versus, say, running into the boards. And and these were incidents that were reported to hospitals, okay? And in 2009, the cost of just those reported injuries was $188 million. And those are just the ones that we know about. So those are people going to hospitals, to emergency rooms for treatment. Okay, we don't know what happens if they go to an athletic trainer, if they go to a physiotherapist, they go to their family physicians. Those costs are not being tabulated at this point in time in Canada because our surveillance system doesn't allow us to do it. So to get back to your question of, yes, Royal Commissions are expensive, but we're already spending an inordinate amount of money treating people for injuries. At what point do we decide which is the more prudent, fiscally or otherwise, course of action to pursue? Because the other thing we're not calculating in the costs associated with sports injury are dropout rates, kids who are dropping out because they've been hurt or are refusing to participate for fear of injury, okay? And what are the implications for obesity and consequently our overall healthcare system? So we really don't have a good handle on the magnitude of the economic impact of sports injury in this country. And a Royal Commission would at least help point us in the right direction on getting some of those answers.
The Royal Commission wouldn't actually stop the injuries, right? So what do you expect it to give us that would help with, like, cut those costs and help stop the concussions? Well,
I think first and foremost, it's the awareness. And people, I mean, if you don't think if you're not aware of something, then you may not think it's a problem. Okay, it's almost like, being an alcoholic. The first step to recovery is recognition. And that sounds a bit trite, but if we don't identify the issues, then we're not going to be able to say, okay, what are our best practices? What are the best courses of action? And the capacity that a Royal Commission has is to bring all the key stakeholders together. And the fact that the federal government in particular already is invested in sport suggests that they could be and should be one of the principal leaders in this initiative.
And I mean, to add to that, your point was very well taken where you said, shouldn't these sporting organizations be governing themselves? And I think that's a great point. At the same time, it's difficult to govern yourself if you don't have the knowledge. We need to equip people with the appropriate knowledge, as Dr. Forbes was mentioning. And the Royal Commission, as Dr. Forbes mentioned, can bring all the key stakeholders together, identify a package of knowledge. Currently, for example, Dr. Charles Tatter has done excellent work with his organization Think First, where they go into schools, and our own charity has actually collaborated with his charity, Watch, and we go into Regent Park in Toronto, and we're in the process of taking these programs and teaching preventative measures or primary prevention for concussions to children. But what's happening is we're going into sporadic neighborhoods across the country. One neighborhood here, one neighborhood there. What a Royal Commission can do is it can take this information that people have put together, a panel of experts, and ensure that maybe it goes into the curriculum or that it reaches every child in every part of the country.
That concludes this press conference today. I'd like to thank you all for appearing here today. Thank you.